In today's video, I'll be talking about how to do CPR, which is an important life skill involving chest compressions and rescue breaths that could save someone's life. Shockingly, only a small proportion of people know about CPR or would be confident enough to perform it on a person who needed it. The main reasons for this seem to be lack of widespread information and the fear of doing it incorrectly. So many people die needlessly due to the people around them not doing anything to help them, and instead rely wholeheartedly on emergency services, who may not get there in time to save their life. I'm sure healthcare providers would agree that it is much better for a person to do CPR imperfectly rather than do nothing, as it can prolong the person's life long enough for the emergency services to take over and hopefully resuscitate them. Although different organisations have slightly different ways of doing CPR, the main principles are the same. Dr. ABC is an acronym that makes it easier to remember the 5 steps. Here are the basic 5 steps you should know about. Step 1. Check for danger. Check that the area the casualty is in is safe to enter. Step 2. Check for a response. Kneel by the casualty's head. Gently pat their shoulders and ask loudly, "Are you all right?" If they reply, try to find out what is wrong with them. Step 3. Check the airway. If the casualty does not respond, turn the casualty onto their back if they are not already. Gently perform a head tilt and chin lift to open the airway. Step 4. Check for breathing. Whilst keeping your hands in place, look, listen and feel for signs of normal breathing. If the person is breathing normally, you do not need to do CPR. Sometimes the casualty is taking agonal breaths, which is where they are barely breathing or taking infrequent, slow, noisy gasps that sound like snoring. This is not normal breathing. Step 5. If the casualty is not breathing normally or you are not sure, you immediately need to call an ambulance, ask for a defibrillator and start CPR. If you can, get someone to call the ambulance on your behalf so you can start CPR sooner, or if you are alone, call the ambulance yourself. The longer a casualty goes without a defibrillator being used, the lower the survival rate. As a general guide, supermarkets, leisure centres and police stations have defibrillators. For adults, kneel by the side of the casualty. Place the heel of one hand on the centre of the casualty's chest. Place the heel of the other hand on top of the first hand. Interlock your fingers. Keep your arms straight. Press down on the breastbone to a depth of 5 to 6 centimetres. Repeat at a rate of just under 2 compressions per second. If you hear one or more rib break, you must still continue with CPR, as breathing takes priority over broken bones. After 30 compressions, open the airway again using the head tilt and chin lift. Pinch the soft part of the nose shut. Seal your lips around their mouth. Give a rescue breath, which is a normal breath. Look at the chest of the casualty for a rise and then fall as the air goes into and out of the lungs. Then you provide the second rescue breath. It should not take longer than 10 seconds to deliver the 2 rescue breaths. Get straight back to the chest compressions. You would keep repeating the 30 chest compressions followed by 2 rescue breaths until the casualty starts speaking to you, the defibrillator arrives, someone more experienced than you, such as an ambulance team, asks you to stop, or if you are alone and you get exhausted. The main difference between adult CPR and child or baby CPR is that with children and babies, you start with 5 initial breaths first. You do this because they are more likely to have a blockage in their airway, which the 5 breaths may help to dislodge. For babies, when giving rescue breaths, you will seal your mouth around both their nose and their mouth. For children and babies, you compress the chest a third the width of the casualty's chest. For children, you only use one hand for chest compressions. For babies, you use 2 fingers to do chest compressions. After the initial 5 breaths, you do 30 compressions, then 2 rescue breaths and keep repeating, just like adult CPR. Additionally, if for whatever reason you are uncomfortable with giving someone mouth to mouth, just doing the chest compressions is better than doing nothing. Thank you for taking the time to educate yourselves. Be sure to check the box below for detailed important information and links about CPR. I sincerely hope that sharing this basic information may save someone's life one day. Please help by sharing this video with friends and family in case they don't know about CPR or need a recap. I hope you have a great day. Goodbye.
Are they breathing?
No, Rose, they are not breathing. And they have no arms or legs. Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there? Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Words it loud, women warm, been kicked around since I was born. Well, it's alright, it's okay. You can look the other way. Let it go, let it go.
Okay.
Staying alive, staying alive.
Yeah, okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911, so you lost them.
Okay.